This is the right chest and right arm of a patient with a panplexus injury. We have explored up at the brachial plexus and found this to be a five-root avulsion injury. We've exposed the spinal accessory nerve for later transfer. We then make this incision along the mid-portion of the arm up into the axilla, using the inferior margin, the pectoralis major as the inferior margin of the incision, and curving around to expose the harvest of the intercostal nerves. Large fasciocutaneous flaps are elevated to expose T3, 4, 5, 6, 7, and 8, for a total of 6 intercostal nerves. We begin by incising the periosteum, overlying the rib, taking a elevator to elevate the musculature and periosteum superiorly as well as inferiorly, which reveals the underlying intercostal nerves. These are dissected out from the sternocostal margin medially and then out laterally, as far laterally as possible. The exposure in the brachium, we raise the fasciocutaneous flaps and come down onto the median nerve initially. We'll identify the medial antebrachiocutaneous nerve just posterior to that, the axillary vein. And we tagged all these structures. We then expose the ulnar nerve, which has the blue vessel loop. And just posterior to that, we find the radial nerve here. Dissect the radial nerve up towards the posterior cord. We see the latissimus insertion here. And then anteriorly we have the short head of the biceps. We develop the interval between the short head of the biceps and the corpobrachialis to identify the musculocutaneous nerve. Here you can see a branch coming off of the musculocutaneous nerve to the short head of the biceps. We then dissect the musculocutaneous nerve up as far approximately as possible to allow for the neurotization of the 3 intercostal nerves into musculocutaneous.